Hello everybody, welcome to the Talking Cafe. Today is Thursday the 24th of November. No, it's not, it's Wednesday the 24th of November. I'm thinking ahead because tomorrow, Thursday the 25th of November, is Carers' Rights Day, which is why we are here today. So really briefly, I just wanted to discuss hospital discharges and what that means for a carer and people that you're caring for that might be in hospital at the moment. So I am a community agent and I work alongside community hospital discharges. So I've only been doing this for a small time now, but I have in my small time learnt the processes and what's involved with that. So firstly, what should a hospital discharge look like? Firstly, and most importantly, a hospital won't send anybody home unless they really are fit for discharge. So that should be a peace of mind for anybody. And as a carer, I think it's very important to make your voice heard from straight away with the discharge planning, so the hospital team are aware of what your capabilities are. So if you feel like somebody's needs have changed and you're not sure you can manage, it's really important to get on board straight away with discharge planning and have your say with that. So the people involved in discharge planning will be a hospital doctor, nurses, OTs, physios, all manners of people. And these people will assess the patient or the person that you care for to see if they need any follow-up medications, whether they have ongoing rehab needs, and also for equipment and aids and adaptations around the home that might be needed. So before a discharge, you may have a home visit from somebody that will assess the living situation, have a look at the space, have a look at the equipment that's in place. And if there is none, they might have a look at what would benefit you as a carer supporting the person coming back home from hospital. There are other things such as piper alarms to make sure if you're not around for any reason, that the person you care for has got access to reach out for help if needed. This is a really good, a simple and effective thing to have in place, a piper alarm. They're available across all districts. In Somerset, each one has their own sort of one. So, you know, Taunton and Bridgewater will be different agencies, but they're all essentially the same thing. It is a paid for service, but it's, in my opinion, worth its weight in gold because there's so many added things they can have now. You can have door sensors. So if the person you care for has dementia or wanders, a door sensor will alert somebody that somebody has left the property or entering the property. Fall sensors are amazing. So if in the nighttime, if your cared for has a fall, it's going to alert the alarm and go off. And then you have your standard piper alarm, which you can press for support. Another thing this service offers, which I feel a lot of people don't really know about, is that they offer sort of medication reminders and any other reminders. They can just do a friendly welfare call just to check in as well. So it's definitely something to consider for the future. So when it comes to discharge planning, they will look at the initial discharge. So whether the cared for is fit to go home and have ongoing support, or no ongoing support is needed if they're medically optimized. Or they might be looking at if the person has more intense needs and waiting for sort of availability of care in the area, or they still got rehab goals to meet. They might be eligible for an interim placement, which is usually in a care home type of facility, which is temporary, just to see them until they've reached more goals or move on to a more suitable position. You might hear discharge to assess being raised in conversations. This is a guidance put in place that looks at discharging a patient from hospital and then deciding what pathway to go ahead with. So pathway 0 is no support, informal care and agencies. So that's where us village agents might step in. So say if somebody doesn't have any care needs at all, but struggling with the cleaning or walking their dog and just the minimal tasks. So that would be pathway 0 and looking at community solutions there. Pathway 1 is additional support at home. to enable somebody to return home with a new package of care, or if they had a package of care before they were admitted to hospital, then that can be reinstated. Pathway 2 is recovery and rehabilitation, assessment and care planning. So this is usually short-term intensive care. So like I mentioned before, a 24-hour bedded care, such as an interim placement in a care home. And then pathway 3 is people that are already at that 24/7 need and need to return back to that 24/7 need. So if the person you cared for, if their needs have increased since their hospital stay and it's something you can no longer manage, it's very important to raise that and be very realistic about the long-term goals and the suitability of the person you're caring for coming back home again. So if they have already had a care assessment and say had a once-a-day package of care and it's clear that this isn't no longer suitable going forward, whilst in hospital, you can request a new care assessment, which will reassess for the new needs and then put the adequate support in place. If you are over the threshold for adult social care funding, which is £23,250, then they will recommend the care that you should be having, and then they can put you in contact with the people that can organise that care and put you in local contacts of care agencies, care homes, anybody like that. So discharge needs, what are they going to do before they send you home? They're not going to just go, okay, you're fit, off you go, which is the positive thing in that. So what they will do is they'll make sure you have clean clothes to go home in, that you have access to your property. So where are your house keys? Are they on you? Do you have a key safe? You have money for short-term needs, someone collecting you, or hospital transport or a taxi booked. They will make sure that your carer or the patient is going home with an adequate amount of medication and incontinence needs. They will let you know about any local support. So in Somerset, you might be referred on to us or myself as a community agent working with Hospital Discharges. So you might be referred on to additional support. So you could have something like rapid response, which is a temporary package that goes in place, which will check on you whilst you are home from hospital and just make sure that you are safe there and to avoid you coming back into hospital again. And this could be followed up as well by district nurses can come in if you have any dressing changes that need doing if you are unable to attend your local GP surgery or hospital. So as a carer, it's very important that you raise your voice and you are heard and you feel like you are heard. It's really good to have the medical aspect of things and being given a summary of what you're cared for would need, but it's important emotionally to make sure that your needs as a carer are met. This moves me on to my next subject, which is power of attorneys, which was a new thing for me before I started this job, and I did not realise the importance and just the need for it in situations when you no longer have capacity to make those decisions for yourself. So I will be bringing Julie on, and she will be discussing with us today about POAs, so power of attorneys or lasting power of attorneys. And there are two. You got one for health and one for finances. So I'll bring Julie on today. Hi, Julie.
Hi, Ruby.
How are you today?
Yeah, good. Nice to see you. Thank you for asking me on.
Thank you so much for joining me. And like I said, this is a new area for me, the POAs. I was hearing about it once I started this job. And as somebody who has a child and a mortgage and all those important factors in life, it's actually been a massive eye-opener to the need of it. And now working in the social care sector, it's so much more aware to me about how many people don't have it and what a barrier it is in discharge planning and making sure that your cared for needs are met.
Yes, yeah, that's absolutely true. Basically, the majority of people aren't aware that if their loved one, whether that be husband, wife, civil partner, adult child, anyone over 18, somebody else cannot speak for them if they are lack capacity, unless there's a lasting power of attorney in place, and that has to be a form to be completed and a capacity assessment to be done, and it then to be registered with a government body, which is the Office of the Public Guardian, before it can be used.
I think because when you think of planning for your loved ones, you just assume if you're somebody's wife or somebody's mother, you immediately have that right. And that's not the case, is it?
No, it's not the case. Unfortunately, under the Human Rights Act, the power now has to, when you've got capacity, you actually have to nominate people who may in the future need to act as your attorneys, and everybody over 18 should have one.
Brilliant, thank you. So, in a bubble, what is an LPA?
Well, they're quite straightforward. What they are is it's somebody such as myself giving my partner the permission to speak for me if I can't speak for myself in matters of, as you quite rightly said, there's two separate issues, health and welfare being one, and the other one being finances. I recommend that both are done because they're equally as important. It's impossible to really differentiate one being more important than the other. A decade ago, it would have been common sense and people would have been able to speak for particularly husbands and wives. But as I said, that has changed certainly in the last decade or just over a decade, into actually needing. It's a legal deed. It's taken very, very seriously and it's highly regulated, but it just means that the people you love can talk for you.
Thank you. Can you appoint more than one person for your power of attorney?
Yes, you can, and I recommend that you do, because you're looking at using these powers of attorney for the rest of your life. So, for example, if you're having one at 20, and that's not unusual, believe me, you might not be requiring it until well into your 60s, 70s, for example. So you want to have more than one attorney in case some of your attorneys pass away before you or are ill themselves or couldn't act for you for some reason. Then your other attorneys are able to act for you and the document still works, because otherwise you have to start the process from the beginning. If your loved one has passed away, for example, and you've got no attorneys, then you would have to then reapply and re-register, which is taking 4 to 5 months. So it's quite a lengthy process.
Okay, brilliant. Brilliant. And what if a person no longer has capacity or is on that borderline? If they fail a capacity test, are they now unable to appoint a POA?
Yeah, so if they have lack of capacity, the only route then is the Court of Protection, which is where the court will appoint it then changes name. It is an attorney, but the name that's used is deputy. Now, again, in cases of husbands and wife, that would usually be the judge saying, yes, you as the wife can act, or you as the adult child can act, for example. Or if there isn't immediate family, it could be a friend stepping up. But it has to be a court appearance, and lots of information beforehand as to the character and of the person has to be gathered. The earliest court date at the moment is 18 months time, and that's for urgent cases, and it's in excess of £10,000 to actually do it as well. So there's the time and the money factor, and all that time the wife, husband or whoever can't speak for that person, so it's incredibly distressing and frustrating for everybody involved.
That sounds like a real hefty time, isn't it? And when you think it could all be avoided if people knew the importance of this sooner, make the process so much smoother. And I myself have witnessed multiple discharges, and people that don't agree, but they obviously have a voice and they have the right to be heard, but they don't have on paper that legal stance to make that decision for people. So yeah, it's a really stressful situation. But so what is the cost for LPAs at the moment?
Right, so there's a registration fee payable to the Office of the Public Guardian, which is dependent on income or indeed certain benefits. So if you're on certain benefits, there may not be a registration fee to pay at all. If you're on an income less than £1,000 a month, then the fee is reduced by 50%. But if you had to pay the full fee, it's £82 per power of attorney to register them. The actual paperwork itself, you're looking for each document, you're looking at about 25 pages each. You can fill them in online. I would be wary on that, because if you get it wrong, you don't actually find out until you need it. So I would suggest you seek advice. But you don't, it's everybody's choice. If you instruct a solicitor or somebody like myself or a charity or whatever, the prices vary, but you're looking at, for 2 LPAs, £350 is roughly the amount you should be looking to pay.
And I will be adding your email address, because I know that you happily offer advice to people that have any questions about this type of thing, or if they need any support with forms, or they want your service even. So I will be putting Julie's email address below, and if anybody would like to reach out to her about power of attorneys and any more questions you might have, then please feel free. She'll be happy to answer any questions. So, putting power of attorneys into perspective, I wondered if you could just tell me a couple of case studies. One where it didn't go to plan because there was no power of attorney, and then one where it was a godsend, if you don't mind.
Yes, of course. Yeah, no problem. Well, I've had a number of cases recently where it's been at the point where it's actually too late to do a power of attorney, because people have been deemed not to have capacity. And the situation is that loved one involved can't have a full say in that person's care, in terms of where the particular case I'm thinking of, they're needing to go into a care home. It is in their best interest, but they can't have a say into where the actual care home is, which obviously they would like to. And the only route for them is the court of protection. And the other case where it has gone well, there fortunately there's lots of those, but particularly where I've had people that have had a power of attorney in place and have then had one particular person had a brain bleed, no apparent reason, just one of those things. They were unconscious for a period of time, then in a coma, only quite a young person, and the wife could actually speak for the husband. They could actually arrange, in terms of finances particularly, he was the one who worked, the finances were in his name, so she couldn't continue paying the mortgage and the electricity bill and everything like that. But with the power of attorney, she could access them all, tell everybody, show everybody that she was officially, legally his attorney, and then she was able to as much as possible continue life as normal. It is a success. He did come home, he did fully recover. Some adjustments needed to be made to his house, but again, they could be done because he didn't need to sign off on it when he was too ill to speak. And he's hale and hearty now. But it was a stressful time for the family, of course, but there wasn't that additional stress of them not having a voice.
Oh, I'm so happy that it was a nice story and he has recovered now. And I think just taking that stress out of that, or being able to be part of that care planning, be part of the future care, paying the bills, all that type of thing, that reassuring stuff that everybody never wants to go through.
No.
It's just so much more reassuring once you have that official paperwork in place and you are appointed for that. So that's amazing stuff. But thank you so much. Is there anything else you wanted to add at all about power of attorneys, or anything important that you need to add?
Well, what I would say is, most of my clients come to me and they say, oh, I'm not sure about this. In the first instance, I'm not sure who to have an attorney or how many. Just have the initial discussion, talk to someone about it, someone who is qualified to talk about and can question you, because from those questions, you'll think, oh, actually, yes, I could have so-and-so. But because you haven't got all the pieces of the puzzle, it seems unsurmountable, but it isn't. It really isn't. If you've got someone to talk you through it, it is a paperwork exercise that then will give you the ability to talk for your loved ones and give you peace of mind.
I think as well that conversation with loved one is a hard one to build up to, especially, say if you were planning on to appoint somebody and not somebody else, and you need to have those conversations with your family members, and you sort of even though you shouldn't have to, but you do feel that need to justify yourself and why you've made the decision you have. So it can be really hard. So getting some advice and some reason on those situations, great. So
yeah, definitely. As I say, most people, once I've actually had that initial discussion, they've then had time to think about it and think what they want to do. The common comment is, that they're so relieved and it was much easier than they ever expected it to be. So
that's great. Well, I highly recommend everyone just take a look, have a Google, have a read about it and see what you think going forward. But as today's topic is on discharge planning and carers, as an unpaid carer for a loved one, if you haven't looked into this already, I highly recommend it. So we've posted lots of links below this Talking Cafe today, so you can have a click and have a read, and you can pop Julie an email if you want to. So
yeah, always happy to. There's no charge for advice. I'd just pick my brains, no problem.
Lovely. Thank you, Julie, and thank you for letting me pick your brains today. It's great to have you on, and I look forward to speaking to you again soon.
Thank you, Ruby.
Thank you. You take care.
And you. Bye.
Bye. So thank you to Julie for joining me today. Like I said, it's something new to me that I would never have considered for myself or knew was a thing until I was in the social care sector for work. And it has made me, in my personal life, realise that there is an important document to have in place for care planning. So as it's Carers Rights Week this week, please take a look on Facebook pages, our Facebook page. I've put a couple of links below to carersuk.org, which have multiple seminars, questions, live feeds. Even if you're an unpaid carer, that join in a Zoom chat, meet some other people that are going through the same thing as you, or express your views. There is so much going on this week. Please reach out to us if you are struggling or you need advice, or if you're a new unpaid carer and this is all new to you, please come to our service. Our email address and our website is below, so you can reach out to us at any time. Obviously, winter's coming up. It's already very cold, and many families, carers, and people on low incomes will already be making that decision between heating and eating, which is what we really want to avoid as an organisation. So if you are struggling in any way, whether you're a carer or not a carer, please reach out to us and we will offer you support. Thank you so much for joining me today. It's a bit of a short and sweet one compared to my usual Talking Cafes, but it's been a pleasure to share some of my knowledge and insight into my new role as a community agent and hospital discharges with you. And again, thank you very much to Julie, and thank you very much to Joe behind the scenes, who's been doing my IT for me. And have a great rest of the week, and please get involved with the Carers Action Week this week. Thank you.